Gauteng Health Department will not challenge the Health Ombudsman's report into the death of a businessman at Tembisa Hospital. The Ombud found that Shonisani Lethole was not fed for more than 100 hours. He died at the hospital last year, but the CEO of the hospital says it will challenge the report. Let's now bring in Sibongile Tshabalala, who is the national chairperson of the Treatment Action Campaign, who joins us now for some reaction. Thank you so much for your time, Sibongile. Perhaps let me first get your reaction on what we heard from the CEO of the Tembisa Hospital today. He says we are taking that report on appeal, but you've got the health department saying that is not the intention. All right, Sibongile, I hope you can hear me now. I'm asking for your reaction regarding what the CEO of the Tembisa Hospital said. He's indicated today that he will be taking that report by the Health Ombud on appeal, whereas the Health Department in Gauteng says there's no intention for that particular facility to challenge the report.
Good afternoon. It is said that we always have to lose our loved ones. We'll have to lose people before things are taken into consideration. And yes, the Gauteng Department of Health, even if they want to challenge the report, unfortunately they can't, because they know that Tembisa Hospital has been having these challenges for a very long time, even before the issues of COVID. The Tembisa Hospital, we've been engaging with the CEO of that hospital, I think from 2018, raising these issues of overcrowding, attitude of staff, raising issues of patients sleeping on the floors, and patients who don't have money to pay for the services, who are treated as second citizens. So in the issue of patients being staffed in facilities is not an issue of today. This is the issue that has been happening for a very long time. And we've been trying to engage, and we've been engaging the government, we've been engaging the CEO of the hospitals, including the Department of Health in Gauteng, about these issues. But unfortunately, they kept on promising to say they are looking onto the matter, and they haven't, until we lose people. And the Shonisani family, I would like to say sorry to them, and condolences, and other families that were part of the media briefing today, and other families that didn't have a guard or energy to come and report these issues. But all I want to say is that people are dying every day in hospitals. Tembisa is one of them.
So what is it going to take for the health department, and perhaps even the health department at national level, to take this issue seriously and start fixing and moving fast in fixing our public health system? Because you've seen, I'm sure, that once in a while, not even once in a while, a lot of cases happen, but they're simply not reported. So now we're talking about Shonisani, and unfortunately, this will likely disappear, the conversation will go silent, and then until there's another case again. What is it going to take until the health minister, the health MEC in Gauteng also do something about this?
It needs our efforts as communities, as patients who are using public sector. We need to continue to make noise, because as we are saying that we've been seeing these issues happening, we've been seeing people dying every day. People are dying because of negligence, but these reports are only tackled on media when we are making noise at that time. After that, after a few months, after a few days, they forget about it, and they're not doing anything about it. They'll wait until another person also die, and another family reports, or the civil society comes up and say this is the issue. So this thing, it needs us to put more energy on fixing our healthcare system. We need to continue to make noise. We need to continue to hold our government accountable, whether they want to listen or not. But at the end of the day, also, we need a political will. We need to end corruption within the public sector, because we are facing all these challenges because of the corruption that has been happening, where money it's channeled to where it's not supposed to go. So it affects us at the end of the day on the ground.
So who must shoulder accountability then? Because when you speak to the nurses and health other health professionals, they will tell you how overworked they are. The issues are deep-rooted. Some of them are disgruntled because of low pay, because of the lack of resources. And they argue the system is just so rotten, and until you fix that, they won't be able to be as productive as they're expected to be.
Yes, you cannot expect people to give you good services while you are not providing tools of trade, you are not taking care of your workers. So the accountability needs to come from the health minister, from the government as it is. As we are facing this pandemic, it opened eyes maybe to them, and it gives evidence to all what we've been saying for years, to say our healthcare system is in crisis. So a government has to own up, the Department of Health has to own up to its challenges and start working towards fixing the broken healthcare system.
All right. Sibongile Tshabalala, I really appreciate your time. Sibongile is with the Truth Treatment Action Campaign.